Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. SI fusion, sacroiliac-joint-fusion. Introduction. The joints that connect the bottom segment of the spine, the sacrum, with the pelvic bones are called the sacroiliac joints, or SI joints. Sometimes the SI joints can become too loose or inflamed. This can cause pain not only in the joints themselves, but also in the lower back, hips, and legs. SI joint pain can sometimes be treated with physical therapy, medication, and injections. But surgery can help treat SI joint pain when other treatments do not help. SI fusion is a surgery that joins the bones in the SI joint together. SI fusion can help treat pain by preventing the SI joint from moving too much and reducing inflammation. This program explains SI fusion. It talks about why the procedure is done and what to expect before, during, and after the procedure. Anatomy. The spine is formed by a series of solid bones called vertebrae. The vertebrae are separated by softer discs. There are 33 vertebrae in the spine. The vertebrae protect the spinal cord and the nerves that travel from the brain to different parts of the body. Most of the vertebrae are separated by softer discs. These discs help cushion the vertebrae during movement. The sacrum is a triangle-shaped bone at the bottom of the spine. It is made up of 5 vertebrae that are fused together, or connected. The right and left sides of the sacrum connect to the pelvic bones, also called the right and left ilium. The places where the sacrum is connected to the ilium are called the sacroiliac joints, or SI joints. Each person has 2 SI joints, a right one and a left one. These joints have an extremely limited range of motion. The SI joint is supported by ligaments. Ligaments are tough tissues that connect one bone to another. They support the joint and keep it in place. Cartilage covers the ends of the bones of a joint. Cartilage is tissue that keeps the bones from rubbing against each other during motion. Reasons for SI fusion. SI fusion is done to treat pain that affects the SI joint. SI joint pain can happen when the SI joint moves more than it is supposed to, or when the joint is inflamed due to arthritis. Sometimes even minimal movement can cause pain. The SI joint can move too much when the ligaments in the SI joint become loose. This can happen after an injury that affects the hips. Pregnancy can also cause the ligaments in the SI joint to become loose. Certain bone and joint diseases, such as arthritis, can cause pain in the SI joint. Arthritis is a disorder that causes inflammation in the joints. SI joint pain can also happen when there is damage or stress to nearby joints. SI joint pain often happens after surgery on the vertebrae at the end of the spine. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Alternative treatments. SI joint pain can sometimes be treated without surgery. SI joint pain can be treated with sacroiliac injections, medications, physical therapy. Sacroiliac injections use a needle to inject medication inside the SI joint. Sacroiliac injections can numb the area around the joint and help reduce swelling and inflammation. Mild pain can be treated with prescription or over-the-counter medications. Talk to your healthcare provider before starting or stopping any medication. Do not take prescription medications that have not been prescribed to you by your healthcare provider. Physical therapy can help reduce pain and help you regain your normal range of motion in your SI joint. SI fusion. SI joint fusion can be done as an open procedure or as a minimally invasive surgery, MIS. Advantages of MIS techniques over open surgery include smaller incisions and a shorter hospital stay. Minimally invasive SI fusion is done under general anesthesia. This means that you will not be awake during the procedure. Your surgeon will use X-ray imaging to see the structures inside of your body. The operation aims at connecting the sacrum and ilium with metallic devices. Sometimes bone can also be pushed inside the SI joint itself. The devices are inserted through a small incision. The bone used can either be harvested from your own hip bone or it could be cadaveric bone. Cadaveric bone is bone that comes from a dead body. It has been tested for diseases and is safe to use. Your surgeon will close the incision. SI fusion usually takes around 1 hour. SI fusion can alternatively be done using a bigger incision where the surgeon can directly visualize the joint without needing X-rays. It is also done under general anesthesia. Again, either metallic implants and/or bone can be used to fuse the SI joint. Your surgeon will close your incision. An open SI fusion can take 4 to 5 hours. Risks and complications. SI fusion is safe, but there are possible risks and complications. These are not likely, but they are possible. You need to know about them just in case they happen. By being informed, you may be able to help your healthcare provider detect complications early. All surgeries carry the risk of infection or a reaction to anesthesia. Most healthy people do not have any problems with anesthesia. Some people have mild and temporary symptoms, but anesthesia is safe. Risks of anesthesia include cut lips and chipped teeth, headache, nausea or vomiting, problems urinating, sore throat. Other serious risks of general anesthesia include heart attacks, lung infections, strokes. Your anesthesiologist will discuss these risks with you and ask you if you are allergic to certain medications. Blood clots in the legs can happen due to inactivity during and after the surgery. These usually show up a few days after surgery. They cause the leg to swell and hurt. Blood clots can become dislodged from the leg and go to the lungs. There, they can cause shortness of breath, chest pain, and possibly death. Let your healthcare provider know right away if you experience symptoms of a blood clot. Sometimes, shortness of breath can happen without warning. Getting out of bed shortly after surgery may help decrease the risk of blood clots. Other risks are seen in any type of surgery. These include 1. Infection. Infection may be at the skin level or deeper in the tissue. Deep infections may harm the bone itself. Treating deep infections may require long-term antibiotics and surgery. 2. Bleeding, either during or after the operation. 3. A skin scar. Other risks and complications are related specifically to this surgery. These are rare, but it is important to know about them. Fluid may leak from around the nerves close to the SI joint. There is a small chance that blood vessels around the SI joint may be harmed. This can cause bleeding around the spine that is dangerous. Nerves around the SI joint could be damaged during the procedure. This can cause numbness or problems moving. Rarely, intestines around the spine can be damaged. This can cause problems with bladder control and bowel movements. Rarely, SI fusion can cause problems with sexual function. Rarely, the fusion may not take and/or the implants may break or get displaced, requiring another operation. Sometimes the procedure is not successful. Another surgery may be needed. This is more likely to happen in patients who smoke. After the procedure, your healthcare provider may limit your activities after an SI fusion. These limits depend on what kind of surgery you had. Ask your healthcare provider how you should care for your incisions. Slowly increase your daily activities while you recover. Avoid strenuous activities and exercise until your healthcare provider tells you it is okay. Ask your healthcare provider when you can resume your normal activities. You may feel weak or tired after the procedure, but it is important for you to walk. This helps prevent fluid buildup in the lungs and blood clots. Avoid sitting for long periods of time. When you sit, prop your legs up to help prevent blood clots from forming. Your healthcare provider may recommend that you use crutches, a cane, or a walker to help you walk. You may need to wear a brace while you heal. Ask your healthcare provider how to use these devices and how to take care of them. Do not twist or bend at the waist. Do not lift objects that weigh more than 5 to 10 pounds, 2 to 5 kilograms. Your healthcare provider may recommend physical therapy after an SI fusion. This can help you regain your full range of motion and resume your normal activities sooner. Do not drive while taking strong pain medications. Ask your healthcare provider when you can drive again. Don't take a bath or use a hot tub until your healthcare provider says it is okay. Do not go swimming until your healthcare provider says it is okay. Stop smoking if you smoke. Smoking makes it harder for your body to heal. Talk to your healthcare provider if you need help quitting.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. The joint that connects small bones at the bottom of the spine with the bones in the pelvis is called the sacroiliac joint, or SI joint. Sometimes the SI joint can become too loose or too tight. This can cause pain in the lower back, hips, and legs. SI joint pain can sometimes be treated with physical therapy, medication, and injections, but surgery can help treat SI joint pain when other treatments do not help. SI fusion is a surgery that joins the bones in the SI joint together. SI fusion can help prevent the SI joint from moving too much and can help treat pain. SI joint fusion can be done as an open procedure or as a minimally invasive surgery, MIS. Advantages of MIS techniques over open surgery include smaller incisions and a shorter hospital stay. SI fusion is safe, but there are possible risks and complications. These are not likely, but they are possible. You need to know about them just in case they happen. By being informed, you may be able to help your healthcare provider detect complications early. Your healthcare provider may limit your activities after an SI fusion. These limits depend on what kind of surgery you had. Your healthcare provider may recommend physical therapy after an SI fusion. This can help you regain your full range of motion and resume your normal activities sooner. Thank you for using Explain.